Here's what to expect during your prep visit. At the beginning of your appointment, we will have you complete any necessary paperwork. Then we will take your before smile photos and video. We then will take the time to review your smile goals. And during this time, we'll talk about the things you like and dislike about your smile. We'll also talk about what you want your new smile to look like versus what you don't want your new smile to look like. Then we're gonna review your wax up, which is the rough draft of your temporaries. We show you on a model of your teeth, the before versus the model of the newly designed temporaries, so you can start to visualize the changes we will be making at this appointment. We then take x-rays of your teeth and any other impressions we need to get started. After we examine your teeth and x-rays, we will review the prep style that we will be doing. We'll go over minimal prep. We have to prep between the teeth more. The more that's going on with the teeth, the more we may have to do to improve them. For example, if the teeth are crooked and have large fillings, that will not be minimal prep. We then get you comfortable with nitrous and Valium as options to help you relax. We give you headphones and let you pick something to watch on Hulu or Netflix. Once you're comfortable, we put on topical anesthetic gel. We do this before we do the numbing anesthetic or numbing shots. Once we give you the numbing shots, that part only takes a few minutes. Once you're numb, we take more photos and videos close up of the teeth. The first thing we're gonna do is laser gum contour and then prep or shape the teeth to get them ready for the future veneers. We take impressions of the teeth and several impressions of you biting down and impressions to get the level of the smile corrected. We then make your temporaries and clean and shape them up and make sure your bite feels good with the new temporaries. We then let you look at them and then get your initial feedback. Since you're numb, it's often hard to tell how good the temps look because the upper lip can look a bit swollen. The numbing usually goes away within a few hours after the procedure's done. Then we'll go over the measurements or sizing of the teeth, the desired shapes of the teeth, and we will then help pick the color for your final veneers. We'll give you some Advil at the end of the appointment and prescribe a light pain medication if needed. This appointment's about 3 to 4 hours depending on how many teeth we're doing.